So iodine, what is it? It's an inorganic element that is available in a range of foods. Iodine is actually a trace element, and trace elements, as you can see here, are not as prevalent in the body as the major minerals. Iodine was discovered in 1811 by the French chemist Bernard Courtois. In the 1920s, it was proposed that iodized sodium chloride, that is table salt, should be used as a means of preventing goiter. Goiter is the enlargement of the thyroid gland, which is visible through the neck. The function of the enlargement of the thyroid gland is literally to absorb more iodine. Here's another example of goiter, but for now I'd like to discuss the roles and benefits of iodine. So human life is dependent upon the presence of iodine. It's absorbed through the brush border. We need iodine for growth. Iodine is actually a structural component of the thyroid hormone. And thyroid hormones control the rate of oxygen used by the cells. So they regulate the metabolic rate and how fast the body uses or stores up energy. The thyroid hormones are also responsible for neurological and muscle functions, erythropoiesis, production of blood cells, mitosis, growth, reproductive health, and thermal regulation. So without those hormones, we don't function very well. Other benefits may include the prevention of some autoimmune diseases, cardiovascular disease, as we'll look at soon, multiple sclerosis, endometriosis, and mental, metabolic, reproductive, and gastrointestinal microbiome disorders. For our brain and our nervous system to work, fetal iodide availability in utero is absolutely essential for neurological development. Now I'd like to further explore deficiency and excess. The prevalence of iodide in utero prevents the condition of cretinism. As you can see here, it's the permanent and severe mental and physical retardation. Recommended daily intake during pregnancy is 220 micrograms per day, and after pregnancy during lactation 270 micrograms per day, as recommended by the National Health and Medical Research Council. The school-aged child, and here we are again with the Filipino boy, will usually represent signs of an enlarged thyroid gland, and learning difficulties will probably be present, but you can treat the learning difficulties and the goiter with good food and supplementation, and the recommended daily intakes for someone of this age would be from about 90 to 150 micrograms per day. Obviously, if you were treating a serious condition, you would increase that amount to the upper limit. Approximately 800 million people worldwide suffer from iodine deficiency, making it the most common preventable cause of brain damage. And other scientists have estimated that approximately 60% of the global population have an undiagnosed thyroid problem due to iodine deficiency. And the majority of these cases of iodine deficiency and related thyroid problems occur in developing nations because of the iodine deficiency in the diet. They may not be living near the sea, and they may just not have iodized salt available to them. So the health benefits of iodine may not be limited to cognitive development and function and as a thyroid hormone precursor, but also prevent the development of some cancers by enabling apoptosis. For example, this study looked at 45 cancer death autopsies of malignant thyroid nodules, and these cancerous nodules had 97% less iodide in them and 68% less selenium in them than normal thyroid tissue. Now, this connection may indicate a potential synergistic relationship between these trace elements in preventing thyroid cancers. That's a theory, but it is complemented by selenium's requirement in thyroid hormone synthesis. So what is the mechanism of action in terms of cancers? The mechanism of action would be that the development of cysts in glandular tissue, which may lead to nodules and then become fibrotic and then hyperplastic, may lead to the tissue becoming cancerous. And this cascade of events could actually be avoided if iodide was available at the tissue. According to Dr. Brownstein, it is possible that the presence of iodide may actually turn some cancer cells of the mammary, thyroid, and internal reproductive glands, may turn these cancer cells back into normal tissue. So this is an interesting journal article. It's a new hypothesis about the correlation between iodine and gastric cancer, so stomach cancer. It explores that iodide bioavailability supports immune function and reduces the risk of stomach cancer. When I found this, I was skeptical until I saw this trial where they actually have a reduction in stomach cancer risk by up to 29% with the prevalence of iodide in the body. Another benefit of iodide is the significant reduction in risk of cardiovascular disease. If the hypothalamus triggers the release of the pituitary's thyroid-stimulating hormone and the absence of iodide prevents the normal production of thyroid hormone, the thyroid-stimulating hormone level continues to rise. Elevated thyroid-stimulating hormone levels may affect endothelial function of coronary arteries, leading to vasoconstriction and impaired blood supply to the heart. This study here actually found that 2,550 subjects with only slightly lower than normal thyroid function had an increased risk of 260%, so 2.6 times the risk of cardiovascular disease. Now I'd like to look at the Australian RDIs. Life stages, so infancy, 90 to 110 micrograms per day. Children and adolescents, 65 up to 150 micrograms per day. Adults, from 100 up to 150 micrograms per day. Pregnancy, 160 to 220 micrograms per day. And during lactation, 190 to 270 micrograms per day. The upper level of intake would be for therapeutic doses and therapeutic purposes if you had a patient that was definitely iodine deficient. Iodide uptake may actually be impaired at the thyroid gland by things called goitrogens, such as soy, cruciferous vegetables, elemental halogens, and cyanogenic glycosides, such as those found in flax seeds. Now, I'd like to get a little bit deeper into why we may not be absorbing enough iodide even though it should be abundant in our food sources. Iodine, like all group 7A elements, actually are chemical halogens. So this is the 7A elements coming down here, and that means they're salt generating. They'll actually bond with the group 1A elements to create a salt. The electron configuration, again, you have a look at the outermost valence shell of the halogens. They all react the same because they have 7 electrons in the outermost shell and are willing to accept 1 electron. So the reaction of iodine becoming iodide happens prior to absorption in the digestive tract, and iodine becomes the iodide ion. So it is possible to hypothesize that the mandatory fortification of fluoride and chloride in the water and bromide in bread may actually interfere with iodide in the body because they're competitive inhibitors, resulting in excretion and deficiency of these essential micronutrients. Okay, so our solution is iodized salt, which is fortified with 25 to 65 milligrams of iodide per kilogram of salt. And we are mandatorily making our bread manufacturers use this salt under Australian government law to make sure that people don't get goiter or have neurological impairment, mental and physical retardation of their children. Iodine is actually commercially available in a concentrate called Lugol's iodine or Lugol's solution, and always use it in combination with selenium. Seaweeds like chlorella, nori, kelp, arame, wakame, hiji and dulse are also very rich in iodine. Excess intake of these seafoods and this solution could lead to iodide toxicity and hyperthyroidism, and similarly to the deficiency, excess iodide can result in enlarged glands and disrupt thyroid function. If that happens in utero, the overabundance of iodide can actually enlarge the fetal thyroid gland and cause suffocation. So please, if you fall pregnant or are planning, see a professional about a nutrient plan. In conclusion, iodide intake is important for cellular development, tissue and organ function, and cellular life cycle, apoptosis. as well as endocrine function across the lifespan. And there are many chemical and epidemiological variables that may influence iodine level. Please see the references listed in the thread where this was posted. Thank you.